Are you still uncertain about trying testosterone replacement therapy or TRT? Do you think you might have a genuine clinical and medical necessity for testosterone replenishment with the intention of treating hypogonadism, low T, hypotestosteronemia, andropause, or androgen deficiency syndrome? Have you talked to a friend who has experienced the miracles that TRT can deliver? But at the same time, you are somewhat concerned about the possible adverse side effects? Good. You should be concerned about the benefits and side effects of TRT. Even if properly administered, testosterone treatments can potentially be risky. It is a potent hormone just like growth hormone, and specific, precise medical protocols need to be followed to avoid side effects. In short, this is nothing to try at home by yourself. TRT requires a protocol prescribed by a physician specialist if you want to do a hormone program properly. Our physicians are experts in tailoring testosterone programs that work to replenish deficiency in men or to stimulate the natural production of T within the body. Both topics are essential knowledge factors in your decision to undergo a testosterone therapy program. By contacting us, we will provide you with the most professional, cutting-edge care available by testosterone specialists with over 10 years' experience prescribing this vital androgen hormone. We have the experience, the knowledge, and the expertise to make sure you will enjoy the benefits of TRT without the possible side effects. Let's take a look at a few of the benefits TRT can deliver. Research from Boston University School of Medicine, BUSM, implies that testosterone treatment in men with low testosterone levels, low T, restores standard lipid profiles and may reduce the risk of cardiovascular disease. These findings currently appear in the International Journal of Clinical Practice. The dreadful metabolic syndrome, MET-S, is associated with increased risk of cardiovascular disease and diabetes mellitus. There is a proven link between MET-S and testosterone deficiency. Hypogonadal or low T men are much more likely to suffer from metabolic syndrome, which is characterized by dyslipidemia, an abnormal amount of lipids, for example cholesterol or fat in the blood, insulin resistance, diabetes, and hypertension. Not surprisingly, obese and overweight men quite often suffer from testosterone deficiency. Obesity is a downward spiral because belly fat often tends to cause estrogen to increase out of control in some men. In this observational study, BUSM researchers investigated the effects of testosterone treatment in 255 hypogonadal men between the ages of 33 to 69 and followed them for 5 years. They discovered that men treated with TRT experienced a gradual decline of their total cholesterol, low-density lipoprotein cholesterol, LDL/bad cholesterol, triglycerides, and increased high-density lipoprotein, HDL/good cholesterol. Quote, "In addition to improving their cholesterol levels, we found that the testosterone treatment resulted in marked reductions in systolic and diastolic blood pressure as well, suggesting amelioration of hypertension," end quote, explained lead author Professor of Biochemistry and Urology as well as Research Director of the Institute of Sexual Medicine at BUSM. Dr. Traish concluded that this treatment also lowered fasting blood glucose and hemoglobin A1C, a surrogate marker of hyperglycemia, suggesting that testosterone treatment may improve insulin sensitivity and hyperglycemic, high blood sugar, control. It also slashed levels of inflammatory biomarkers such as C-reactive protein, CRP, and improved signs of liver dysfunction such as alanine aminotransferase and aspartate aminotransferase, suggesting a reduction in the inflammation responses. Quote, "These data are congruent with our previous work in which we reported that long-term testosterone resulted in a gradual decline in weight and waist circumference and strongly suggest that testosterone therapy in hypogonadal men may prove useful in reducing the risk of cardiometabolic diseases," end quote, Dr. Traish added. In another study led by Dr. Shailendra Bhasin from Harvard Medical School, atherosclerosis or hardening of the arteries did not advance in men with low T treated with TRT for 3 years. Aging men, average age 67.6, received testosterone gel or a placebo, fake testosterone, daily for 3 years. The dose was monitored to ensure that blood levels of testosterone were between 500 and 900 nanograms per 100 milliliters of blood, the normal range for young men. The results? Testosterone did not cause changes in the thickness of the coronary or carotid arteries or blood vessel calcium deposit. TRT does not accelerate coronary artery disease in aging men. Though some research indicates that it does, there seems to be enough evidence that it does not. So there is conflicting data on this point. Got impotence or erectile dysfunction, ED. Think about those two words. Words that no man, regardless of age, ever wants to experience. Two words loaded with horrendous connotations. The diminished quality of life, the loss of zest for life, the inability to perform and feel like a man. When looking at the causes of ED, low T leads the parade of horrors. This doesn't mean low T is the only cause. There could be other factors that need investigation. But in a significant number of men, low T is the primary contributing factor of ED, and replenishment of testosterone helps to alleviate many of the erectile dysfunction and impotence symptoms in hypogonadal men. Throughout your life, testosterone plays a vital role in regulating sexual, mental, and physical health. This is the connection between low T and ED, as well as low libido, depression, anxiety, muscle wasting, and little energy. The good news? We can help by treating your low T condition once and for all. The problem is simple. Around our third decade, men begin to not only just experience but notice a gradual decline in testosterone. Studies show that this occurs at a rate of approximately 10% per decade, but decline rates can vary in men. In younger men, low T may be caused by common problems like obesity, diabetes, congenital factors, genetics, and stress. When the gruesome tally is added up, low T may affect up to 5 million American men, and the number seems to be growing. Worldwide, the problem of low T, hypogonadism, andropause, androgen deficiency syndrome, and hypotestosteronemia are becoming epidemic mainly because there is a vast and growing class of senior men who are living longer lives. However, the growth of the senior population worldwide is not the only factor in the low T epidemic. There is a growing sedentary lifestyle emerging in the information age. Fast food, processed food, and restaurant food, which are often fatty, low in nutrition combined with the sedentary lifestyle of a growing segment of the population, is wreaking havoc on global testosterone levels. Quote, "The lower your testosterone goes, the more likely you are to have the common symptoms like low energy and low libido," end quote, says Daniel Shoxis, MD, a urologist at the Glickman Urological and Kidney Institute at the Cleveland Clinic in Ohio. Quote, "A profound reduction can cause less common symptoms like anemia, osteoporosis, depression, and confusion," end quote. The doctor added that not all men would need treatment for low T, and if you are suffering from these symptoms, get tested by a medical professional to measure your testosterone levels. Got low T symptoms? When symptoms indicate that you may have a low T problem, a simple test can help make the diagnosis. The best time to get a blood test to measure your testosterone levels is in the morning, when levels are highest. Quote, "There is an extensive range of normal and testosterone levels change during the day," end quote, says Dr. Shoxis. The normal range is anywhere from 300 to 800 nanograms per deciliter. You would not be considered to have low T unless you had a number below 300. Thus, if your testosterone levels are lower than 300 nanograms per deciliter, you are a candidate for testosterone replacement. We can offer you a blood test prescription for LabCorp in your city to determine this level. Dangerously low testosterone levels may occur or be beneficial under some conditions. One example is the treatment for prostate cancer. Because prostate cancer is considered by some to be fueled by testosterone, doctors may use procedures to block testosterone in advanced cases. This is called androgen deprivation therapy, ADT. To continue learning about ADT, please visit part 2 of this video series.